Hi guys, welcome back to Dr. BKM Institute. Please subscribe our channel if you have not. Before subscribing, if you want to watch this video, you have the complete authority to and the right to. So yeah, I will record this reading question for you, and also you may contact us for the best OET coaching on +917696734256. So recording one of the reading questions, I hope it will help you to understand how to do OET readings. So the question number is this. So we are talking about a question. I will try to make it easy rather than complex. First of all, in the reading, the main thing is that you should understand the question. The group known as impatient patients means the patients who are impatient. Impatient means they do not have the patience. So the impatient patients mean the people who are looking out for the quick return. So like if we are preparing for OET, if we are patient, then after joining we will wait for 2-3 weeks to learn something. Whereas if we are impatient, we will start getting negative within 3 days. Oh sir, OET is very tough. So impatient patient means the patients who do not have patience are more likely to continue with the course of prescribed medication. So this also, sorry, I'm recording this question, but it will take some energy, but please listen to this video. It will be very nice learning for you when you are preparing for the OET as well. So the people who are impatient, they are likely to continue the prescribed medication. Means if doctor has told the patient to take the medication, they are likely to continue the medications if, what is the condition, what is the circumstance that where they are likely to hold on to the medications, they will likely to take the medications. So what are the conditions where patients are likely to take the medications? Let's see. Medication adherence and impatient patients. So topic is also same. Adhere means that you are adhering to the routine. Adherent means that you are complying to the medication. Compliance means that you are taking your medication on time. So whenever you read the word adhere or compliance, that means you are taking your medication on time. So recent article address the behavior of the people who have a taste for the present rather than future. So the impatient patient means they think about the present, they do not think about the future. That is what, because the person who understand that he or she, if will clear OET, will become a registered nurse in a foreign country, then the patient, then the person will have patience. But the person who wants to think only about today, that today the reading was tough, I can't do it, so these people do not have the taste for the future, they have the taste for the present. That means they think about short term benefits. So it proposed that these called so impatient patients are unlikely to adhere to medications that require use for an extended period. So if the extended means if the period is long to take the continuous medication, they are unlikely. Unlikely means they will not take the medications because they are impatient. The article proposes that an impatient genotype exists and that assessing this patient's view of the future while stressing the immediate advantages of adherence may improve adherence rates. So how can we improve the adherence rates? By stressing on the immediate advantages. That means by talking about the short-term benefits. So if you will talk about the short-term benefits, they will adhere to it. So that is how simple this question is. And anyhow, when you understand the meaning that impatient patient means the patients who do not have the patience, so they will adhere to the medications if we will talk about the short term benefits. And when I'm teaching OET, obviously short term benefit is nothing, it's a very long term benefit. So you need to have patience when you are preparing for the OET. I do not have anything that I can tell you this would be beneficial, you all know this would be beneficial, but in case of the patients taking medication, you can tell them that short term benefits, immediate gains would be better for them. Now my question is solved. I will read the extra lines. The author suggests that rather than attempting to change the character of those who are impatient, you cannot change the characters of those people who are impatient. It may be wise to ascertain, it may be wise to ascertain means that the patient's individual priority, particularly as they relate to immediate gains. Immediate again means short term benefits. So that is the word you need to catch. Immediate. Immediate means short term benefits. So patients are likely to adhere to go if short term benefits are explained. The rest of the lines, for example, now these are given in the examples. Now rest is given as example. For example, if you are talking to an impatient with the diabetes, then stress the improvement in the visual activity rather than avoidance of retinopathy. So if you will talk to them about retinopathy, that is a long term goal, so they will not understand. But if you will tell them about the visual acuity, that it can, if you will talk about that, if you will not follow medications, your eyes will get affected, you will not be able to see, tomorrow also your problem will, your eyes will become worse, then they will adhere. But if you will talk about retinopathy, they will not adhere. Additionally, linking the cost of frequently changing prescription, that if you will link the cost, that if your eyesight will change, then you will have to change the glasses, then again you will have to bear the cost of the glasses, then also they will adhere. So you have to tell about them short term losses rather than long term. So that is how these people will stick to the medication if you will talk to them about short term benefits. That is how simple this question was. The next question that you have asked me is question number 5, but I will like to record a different video for the same. So I will stop this recording, we'll take another question, then after two questions I will let you know. Thank you very much. This is Dr. Bhupesh from Dr. BKM Institute. Thank you.